If you look real closely, any part of the body that comes in pairs, your eyes, your ears, whatever, they're not exactly the same. They're not symmetrical. But if you're talking about a woman's breasts that are out of balance, that can be real trouble. And then the question is, how do you fix it?
We are all asymmetric in the statement. Asymmetry is common. The need to do just one thing or on one breast, that is uncommon. So usually we need to do something to get the symmetry the same, but it requires doing something on each side.
It's not that common to do one side, but I've surely done them. I would say it's in the severe asymmetric patient, often the younger patient who comes to see me, maybe even in teenage years, who may have a A cup on one side or really no breast at all, and then have like a D cup on the other side. In breast aesthetics, one is to look good naked, but the other is to look good in clothes. So many of my patients who are coming in for breast aesthetic surgery, actually if they have a bra on, they look okay, and a shirt they look okay. They just know that maybe they want to look better when they're naked. With asymmetry, that's not true. When they put a bathing suit on, or when they're in their clothes, they're going to have to use something to fill in the other side because they're so uneven. And that becomes a real problem. They won't go to the beach. They won't be in a bathing suit on the beach.
In the case of the female breast, 100% of women have some degree of breast asymmetry. And during my consultation for augmentation or reduction or mastopexy, I stand them in front of the mirror and I point out the asymmetries, because I always tell them that you may have lived 20, 30 years with asymmetric breasts that you never noticed, but as soon as I operate on you, you're going to be looking in the mirror 10 times a day and you're going to begin to notice 1 millimeter differences. We know from studies that patient satisfaction for breast reduction surgery is one of the highest of any procedure we do. I think the same is true for breast asymmetries. Patients are so happy with the fact that their quality of life is improved. They're able to wear dresses, bikinis, shirts without having to artificially correct for the asymmetry, and don't care as much about subtle differences or scars.
In Dallas for the Plastic Surgery Channel, I'm John Hammerly.